I'd start by quickly reminding us about the WHO standards for adolescent-friendly services. There are 8 of them. Unfortunately, I don't have time to go through each of them, but on the right, I've just summarized some of the various ways in which Zvandiri as a program is trying to respond to these standards. So I'll refer to some of those as I go through the presentation. So Zvandiri began as one support group for adolescents living with HIV back in 2004. And over the years, it's really evolved with young people into a differentiated care model for children, adolescents, and young people, and has been adopted by the Ministry of Health and Childcare in Zimbabwe as a national model. At the forefront of Zvandiri are community adolescent treatment supporters, or CATs. They're not the feline species, but they are HIV-positive 18 to 24-year-olds who are trained and mentored as peer counsellors and integrated within the Ministry of Health and Childcare service delivery. There are currently 860 CATs in 47 districts across Zimbabwe, so the lessons we've learned are what I'm presenting on today. And really with the help of organisations like PEPFAR, USAID, CDC, EGPAF through CIF, we are being able to scale that up further with over 1,000 CATs in 51 districts. So the diagram on the right, you can't see very clearly, but summarizes how CATs as young people work between the health facilities and the communities, providing a range of services that are integrated within government service delivery to try and improve HIV outcomes. This again is a summary of CATs' work across the cascade, so starting with their role in improving the uptake of HIV testing services through to supporting them to initiate onto treatment, and then the range of work that they're doing around promoting retention and adherence. The services they provided are differentiated, so we call standard support and enhanced support according to the clinical, but also critically the psychosocial circumstances in which they are living. So I'll talk about those in detail as I'm going through now. So what are they doing in terms of HIV testing services? Well, we have the various different models of testing in Zimbabwe, and really in each of those they're playing their part, whether it's capacity strengthening of healthcare workers, supporting HTS directly in the clinics, but both in the facility and in the community they're focusing now on scaling up index case finding. And you'll see on the right that we had a 23% yield from them working in the homes of other children already on treatment and looking for the siblings and other household children or adolescents who have not yet been tested, as well as working with adults on ART in OI clinics. So that combined approach found a 23% yield. And they're also supporting mobile outreach campaigns. I'm cautious of what to say after the previous debate. We're talking about self-testing, but this is very much early in discussions of what role CATs could play. But I think in reality it will be a hybrid model of really supported, supervised testing. Again, this I'll summarize, but this is the CATs level of support. On the left, you see the standard support. It's essentially, those that are doing well, so if adolescents are virologically suppressed, they're retained in care, they're psychologically stable, and they're safe. We're doing a lot of work around child protection issues. If they are, as I say, doing well and fit those criteria, they get monthly support in the home, in support groups, in the clinic, and CATs refer those that need more support as they come across that, as well as support groups and caregiver support. Then really their work for those that fit the criteria on the right-hand side, so they're not adhering, or we know that the viral load is high, they're struggling to be retained in care, they're unwell, psychological issues, and importantly, if they're pregnant, then we enhance the level of contact by CATs. So they increase the frequency of their support and also the content changes in terms of their counselling. The red flag is to remind us, and just to emphasise, CATs are very well placed by being in constant contact with the young people that they're working with to identify when their circumstances change. So I think the key thing with adolescents is, as we know, their lives are changing all the time, and with that come different circumstances. So CATs, by being continually engaged with them, are able to flag or they identify red flags that need further follow-up and assessment. So what are they doing around treatment? They're providing counselling and monitoring for adherence and ARVs through the home, the clinic support groups, SMS reminders. As a country, we're supporting the integration of CAGs and refill groups for adolescents. They use adolescent-focused counselling skills and tools. They're working with caregivers. They're supporting healthcare providers in the clinics. And evidence that we have from an operations research study in Zimbabwe found improved adherence among adolescents who were receiving CAT services. And we have 2 randomized control trials going on at the moment. We're not a research organisation ourselves, but we're partnering with SESHA and the University College of Health Sciences to run these 2 studies. 1 minute. Okay, retention. They're promoting retention through various means, active tracking, mental MPhil follow-up. They're conducting home visits, importantly tracing loss to follow-up. So when the clinics are struggling to relocate young people, they will ask the CATs to go and trace them. Another important thing is that those that move out of their community or change clinics, there are now so many CATs that we can actually link them to another CATs in another part of the country, which we found to be really successful. Janmoda, anyone speaking Shona knows I'm not pronouncing that well, means the Zvandiri mobile database app. So we have a mobile database, we have a database that tracks all young people in the program, and it's now been put onto a mobile app. And so CATs are entering real-time data into their phones, which is then uploaded into our database. Social protection, I just want to really flag this because we're finding such important developments by working with the Department of Social Welfare, because as we know, so many of the factors contributing to poor adherence or poor HIV outcomes are rooted in these issues. And so by training and mentoring social welfare and community cadres, they're called child case care workers in Zimbabwe, to really, when CATs identify issues around neglect, they can refer to social welfare in partnership with the health facilities, and then they're involved in case managing and intensive support for those young people. And just as an example, we're still trying to get data on this, but just as an example, programmatic data, we had 381 child protection and welfare cases reported through CATs in June alone. So now they're being acted on with social welfare, and we're trying to get the Ministry of Health and Ministry of Social Welfare to come together for a combined position on how we manage some of these cases. SRH, so we're careful what we ask CATs to do around this, particularly in the home, so that we don't make them vulnerable by talking about some of these sensitive issues in the homes of young people. So really they're ensuring that those are referred and know how to navigate to these services and to support them to get there. They are, of course, providing information and counselling around rights, responsibilities, puberty, disclosure to partners, couples counselling, and adherence as treatment as prevention. And I've just highlighted the WHO cervical cancer screening guidance, just as a reminder to us all that we're starting early work in this to try and encourage young adolescents to go for these services. They're very reluctant, so we need to be looking more into that. Mental health, we've done work on the right. You see research that we did, again with SESHA, 65% of adolescents with HIV were at risk of depression. This corresponded, probably not surprisingly, with poor adherence. We've also done recent work where adolescents with HIV and depression describe poor adherence as a means of suicide. And we've recently validated, or actually still being analysed, but validated a mental health screening tool for adolescents. And we're looking at building on other work that's been done in Zimbabwe, the bottom left, where Dixon Chibanda found good results training lay healthcare workers to use some of these approaches, mental health approaches, within the work of young adults with HIV and depression. And we're trying to adapt those with CATs. What can we do feasibly that enables them to screen and refer those at risk of common mental disorders? Young mothers and their babies. It was really interesting to hear the work, all the discussions earlier today. We've done very small amount of work on this, but just to flag it, we did do a study with perinatally infected young mothers and their babies, and found 53% had a detectable viral load, 41% had drug resistance, 16% were on second line. There were concerns around non-disclosure to partners, depression, and the majority lacked the psychosocial support and economic support beyond after they'd had their children, and this was a real concern. The 5% seroconversion is programmatic data that we're looking at under our PEPFAR supported program, where young mums have had their children, gone through PMTCT, but then they've seroconverted in the first 6 months of babies. So this is just a concern that we're looking at and working with the Ministry of Health on. And we're planning follow-up studies to look at what happens to these young mums over time and their babies. Disability, this young chap is called Tanaka. He was very proud when we asked for his consent, that he's very proud to know that he would be looking in this photo at a group of international experts. So we do have his consent. And so we've again done early work looking at, we were concerned we were seeing more and more children and adolescents referred to us with a disability. So we started to explore this with the Ministry of Health and found that 54% of positive children and adolescents, 6 to 16-year-olds, it does include children, were diagnosed with some type of disability. So obviously that's across the spectrum. And so we've trained a sort of subset of cats to know how to identify and refer children that they may be concerned about for assessments for impairments. And finding this really successful. And we've worked with the Ministry of Health again to develop a training curriculum for the management of children. Is that for me? Sorry, okay, I've got to stop. Just finally, supporting the national response. So we developed guidance. I just want to flag really the picture on the right, where this is a picture of the clinic staff, and in all those people that are on the picture of the clinic staff, there's a cat right there at the bottom, just to highlight that this is truly integrated within the Ministry of Health response. And so thank you to everybody on there, our donors, Government of Zimbabwe, Alice, who helped with this presentation. Thank you very much. Sorry.